Hello, everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm your host, Dr. F. Scott Field, and I've got with me today two very special guests, Dr. Karen Dwire, who is actually an OT, and her
Hello.
business partner, Sarah Molnar. Ladies, thank you so much for joining. This is going to be a cool conversation because this is an opportunity to use your healthcare knowledge to help people do ADLs, activities of daily living. It's a big one. It's one that a lot of people love to do, and it's travel. So, Karen, start us off. Tell us a little bit about who you are and what you do.
Well, my name is Karen, like you said, and I have been an occupational therapist. This will be 2025 will be my 23rd year. Much of my career was spent as a traveler. I actually got the last year of undergrad degrees that you could get, and in OT. So I graduated in 2002, and worked for a year and was like, ugh, not sure this is for me. Wasn't really why I was working in a skilled nursing facility because the profession from when I had gone into school to when I had left school was, and I was kind of on the 5-year bachelor program, but that's because the OT program was actually extremely hard to get into. But between 1996 when I started in 2002 when I officially graduated, the profession had completely changed, and OT had basically dried up. PT a little bit too because of some changes in PPS with Medicare. So I actually went facility to facility looking for a job for about 6 months, which is kind of hard for probably new grads and younger therapists to believe now because it's basically like you're swatting away job opportunities right now because there's such a demand. But so I finally found a job making 17 bucks an hour working in a skilled nursing facility in 2002. And I just really felt misaligned with it. I wasn't all about the productivity and and back then it was so much easier than it became in the following years. We had I think it was a 75% productivity, which would be a dream nowadays in skilled nursing facilities. But anyway, so I offset my feelings of misalignment by becoming a traveling OT, and I had a wonderful career that spanned really over 19, 20 years, working in 7 different states. I was in Italy for a couple years. I was in Hawaii for several years. I got to go to New Zealand for 6 months on kind of like a non-traditional online job before that was really a thing. And then now I live and work in Germany. So I've had a really wonderful career of being able to at least use this vehicle of occupational therapy and travel therapy, and the fact that we have demand in different places all over the world to be able to still kind of live the life I want, of one of travel and adventure and seeing new things and meeting new people, and combining that with a job that still pays me and supports my lifestyle, but doesn't necessarily isn't like the shining end all be all of what I want to do. So that's kind of how I got that's kind of my therapy background. And then we can talk more later about sort of what's come out of that in the last couple of years. But I wanted to introduce Sarah, who has become my partner in crime in this whole travel gig, and let her share a little bit about her background too.
Let's hear about the left brain, right brain. Let's hear the other side.
Absolutely. I'm the person who left healthcare at 24 for reference. So I was actually working 12-hour overnights in an emergency room when my mother passed away from cancer. She was actually a director of nursing her whole life. When I was growing up, she was the director of nursing for the largest hospital in New Jersey. So my father was a nursing home administrator. I was like bred to go into healthcare. And when my mother passed away and they expected me back in that emergency room 3 days later, like nothing had happened, taking care of other people and making sure they were okay in their hardest moment, I said, this isn't for me. And I left. And then I went into business. I went completely opposite. I became an accountant. I went into business management and managed very large companies, had lots of different sales roles, teaching roles. And finally, after years, I was making all these other people all this money and not really getting anywhere. I mean, yeah, I had some decent paying jobs, mind you, but what did I have to show for it? Like I was still killing myself working 60 hours a week to make somebody else rich. And I still was poor in essence, middle class. And my dad said, when are you going to stop doing it for somebody else and do it for yourself? And that's when I became an entrepreneur. And I opened a business in Las Vegas and it was wonderful and the world was great. And then COVID hit.
Mm-hmm.
And I survived COVID in my business, which was amazing because I was worried. It's a service-based business. I work with clients in person. I couldn't do that. But then the real blow hit. 11 days after I get married, I fall down the stairs of the brand new home we just had built during COVID and break my leg in 3 places and get sent to bed for 6 months, unable to walk. Run your business now when you have to meet with clients in person. And then I realized everyone I knew was one accident away from losing everything. Because I'm not the only person that falls down the stairs or gets in a car accident or has a death in the family or has something where you can't work. And I realized I needed something different because my brain still worked and my hands still worked. I just couldn't walk. So I laid in bed and I figured out how can I make money online and what can I do and what would work. And I didn't want to, sell icky products or spam people or do random things. I was like, what can I do to help people? And I had already been in a service-based business. Travel. And I went into the travel industry and I took all the knowledge I had acquired in business and accounting and the years of doing it for everyone else and my own business and said, I can really make this work where it's something people can do from anywhere at any point in time, whatever time of the day works from them, whatever location they're in. If they're sick in bed, they can still type on their computer. They can still help people. They can still work their job if they have a surgery or an accident. This is a business that can last me forever, no matter where I choose to go. And then Karen found me and we never looked back.
And the rest is history, as they say.
Yep.
So
Mm-hmm.
I love this, ladies, and thank you for sharing your stories because I think it's important here. There's a lot of golden nuggets to take away from that. And I think, those who have listened to the podcast kind of know my story. And I traveled the first year out of PT school once I finally passed my board exam after many attempts. After my dad passed away, and I was working as a PT tech at the time at the hospital where he passed away while I was trying to pass my board exam, and I had to walk by the room where he passed away every day to clock in and clock out, and that really started to wear on me, and I was like, I don't even know if I want to be a PT anymore. Like, why, God, why, right? And so I traveled the first year out just to kind of find myself, kind of, into the woods type stuff, like Thoreau and I was an English major before I was a PT. So rightfully so, I followed that path. But the cool thing here that we're going to dive into is travel. And I hear a lot of times that, oh, you shouldn't, be a travel therapist right out of school. Like you should learn, your skills first. And I was like, nah, I'm good. I'm pretty competent in what I do. So I don't ever not recommend travel PT. I think it's a great opportunity for folks. If you love to travel, it's a great way to see the world. I too got to work in Hawaii for about 5, 6 months. It was awesome. Got to see some great places, and I learned skills in different settings. You just kind of get thrown into it, and it's trial by fire a little sometimes. Yeah, but the biggest issue for me was just learning new EMR every place I went. A new electronic medical record. So it wasn't that big of a deal, right? But if you truly like travel, this is now a good option to pivot into because we're going to talk a little bit more about how you can actually make money helping people travel. And the best part about this is you help people utilizing your skills that you learned in healthcare. You're still keeping that one foot in the boat of healthcare, and it's almost an elevated level. So let's talk a little bit about people who need help with adaptive equipment and travel itineraries when they want to go on vacation, when they want to do things, right? Travel is an activity of daily living, right? Taking a vacation with your family is a meaningful activity of daily living.
Yep.
People need help with that. And guess who's primed to help them with that? Healthcare providers. So tell us a
Absolutely.
little bit about the why behind this and how this all got started and where it evolved to today.
Well, it's actually a pretty cool story how, like, first of all, for me, travel has been interwoven into my life. Like I was a traveling OT. I knew that there wasn't many opportunities for like OTs to travel abroad for like doing a semester overseas or whatever. So I actually went to Hawaii for my internship. Got there in September 10th, 2001. That's another story. So then I just, and then later in life when I was dealing with different traumas, I've told you before, like, not only was I am I a survivor of childhood leukemia, which I was telling you before, like I got to like that was a kind of fun in some ways for me because I was 5 years old when I got diagnosed. And so I didn't have to go to school for one. And two, of course, when you're in kindergarten, you love school. But and we were taking trips back and forth from Western Colorado to Denver. And it was when Glenwood Canyon was being built, if anyone's familiar with how all that, like Glenwood Canyon and all that kind of space. And so we used to jump out of the car and like go run and play the license plate games while we were waiting for like like the construction to pass and stuff like that. Just a 5 and a 7-year-old like running through traffic and whatever. And then we would take a family trip every year. And we would save up, and I remember the big jar in my mom's closet that we would throw pennies into, and somehow 20s and 50s and $100 bills would show up and nobody knew where they came from. And so we went to all the national parks and stuff growing up. And then when I was 18, I was in a bad car accident. And that today, I mean, I basically lost half my face and got to miss school again. I kind of bookended my school years with tragedy. But that combined with some other things that happened in my life were very traumatizing in different ways. Physically traumatizing. I've had 25 surgeries. I lost an eye, all that kind of stuff. So I think, whenever I hear Sarah's story and like we came together, like we collided in very like coming from very different spaces, but I literally found her in a Facebook group doing what she now teaches hundreds of therapists and other people how to do, which is attraction marketing online and using online on social media for completely no money whatsoever. It's the best place to practice that kind of thing. And we'll talk more about that. But so, we came together in two very different ways, but we had similar whys in that we knew that I knew that my body couldn't keep going with traditional therapy in another way. And COVID, I was actually on medical leave when COVID hit. I lost where I lived. I lost my job. I lost, my health kind of because I couldn't get the health services I need because it wasn't COVID related. And you were out of luck if that was the case for like 2 years. And so, I was stuck without a plan B. And, like you say, the best time to plant the tree was, 20 years ago, so you can enjoy the fruit right now, but the next best time is today. So I was actually trying to breathe new life into an old business because I think another false thing that I love shattering for therapists and other rehab professionals and healthcare professionals is that we have to, if we don't want to go into traditional settings, we have to go into health and wellness, because that's kind of the two kind of go hand in hand. And so I was actually trying to breathe new life into a health and wellness business, one where I did different things with consulting and coaching and products and stuff like that. And when I saw her speaking, I had been looking, could I become a travel agent? Could I do something? I just want to do something completely different, but I didn't know a pathway to get started. So when I heard her talking about something completely unrelated to what I was doing, but then my little Snoopy ears went, when she said travel, I was like, excuse me, so, and then I actually messaged her, or I went and clicked on her profile, I messaged her, and that started this sort of crazy ride that we've been on since then. And I'll let Sarah, I've been talking for a while, but it's pretty crazy when you look at our numbers and what we've been able to do in about 2.5 short years. So I'll let Sarah speak to that a little bit more.
Sure. Yeah. I mean, Karen found me in a Facebook group where I was coaching and she slid into my DMs and is like, I need to work with you. And what I really like to do is help people figure out what they're good at and combine it with travel. So whoever you are, I don't, my background in healthcare ended over 15 years ago. So, she came to me and she was like, I still love healthcare, right? She doesn't not want to help people and not want to be a therapist, but she wanted more and she wanted another path. And we just started going back and forth and talking and talking. And she kept talking to more and more therapists. And she's like, I keep talking to therapists who all keep saying the same thing. Like they wish they had a way to be able to still use the skills. They still want to help people. They still like assisting people, but how can they do it without killing their bodies or not getting paid what they're worth or being put in situations where they're punched and kicked and injured at work and just all the issues that, you know, you guys deal with. And she was like, why don't I help therapists just do this? Like, why don't I help them use their skills and book travel for people and help people who have special needs? Because who else is going to know it? And I said, you're right. I said, because if somebody comes to me and asks me for something and they have a special need, I'm not trained in how to handle it whatsoever. But if I go to Karen and say, this person has a wheelchair, what should we do? Karen's going to have answers to that question. So why not help healthcare workers help those who need it? And almost every need today, almost everyone who's traveling has a special need. They don't even realize it. Between the visible ones and then all the invisible ones, because Karen works with those too. She talks to people about PTSD and trauma and, you know, autism. There's so many different things that people need help with when they travel and that people avoid traveling because of. And if you can help them so they don't have to avoid it, you have a very successful business, but you're also very fulfilled in what you're doing because you're helping clients every day. You're making a difference in their life and they're thanking you for it. You're happy at the end of the day, sitting at home potentially in your jammies, working with clients and giving them what they need and still utilizing your skills. Like it came together so naturally and it's been amazing. We've helped, I mean, almost what, 1,000 healthcare workers between therapists, nurses, doctors, CODAs, PTAs. I mean, like there's every designation and you can
Psychologists,
think
we
of.
have, yeah, and we have, I mean, special ed teachers, school psychologists, even if you look outside of healthcare a little bit.
Healthcare adjacent, even.
Yeah, yeah. I mean, I call it the institutionalized people, you know, healthcare, education. Like we're probably speaking to one of two audiences right now. So yeah, it's been truly incredible. And we started just having conversations with other therapists, of course we started because it was, the OTs and the PTs were mainly the first people coming on, and the assistants, of course, as well. But we had, we were just having a lot of conversations, and then we kind of just created this little Facebook group and a Google Doc, and, it was just kind of this grassroots thing for a while. And then about a year ago, a little over a year ago, actually, I decided it needed to become something official. So I founded a company called Accessible Travel Planners. And because we were just having hundreds of people come on. And I'm not like, that's not even a lie. Like to go from, I think from September or October 1st until, and I could even move that up to probably January 1st until June 1st of 2023, we had over 150 people join us in it. It's probably closer to 200. I mean, really, honestly, that were therapists. They were just coming in droves because we had such an answer of a non-clinical way to combine what you know and what you love with something else that you love, which is travel, which is what 95% of people feel the same way about travel. It's the universal occupation, just like dogs and coffee and all that kind of stuff. So, but so I founded Accessible Travel Planners. I put a course up on Thinkific and I pre-launched it in early 2024, earlier this year. And then I got the random opportunity to work with mastermind.com, which is Tony Robbins and Dean Graziosi. And they actually chose me to come out for a live launch session in June to Scottsdale, Arizona. I was one of 40 people chosen they looked through and they said, who's doing something different and unique that we want to support and help build. And so I went out for 4 days traveling from Germany, where I live now, to Scottsdale, Arizona, 9-hour time change after I'd done it the previous month, to go to our team retreat in Las Vegas, which our second annual one is coming up, big plug, in May okay, end scene. But anyway, so now it is officially relaunched on the Mastermind platform. And we have been just running specials and coupons, Black Friday and Christmas and New Year's and all this kind of stuff, just trying to get as many people on. It's a complete guide that actually has pretty much every base covered as far as travel goes. So what's been really amazing is that Sarah got the opportunity to create a getting started course that launched just a few weeks ago for anybody who starts with us to become a travel agency, because we have a travel agent, because we have a path for that, where they can become travel agents that are partnered with a host agency, the same one that we are. And then we will take them and help them become, up and running in their first 28 days. And she's got a very simple day one, you get it, you complete, you continue, you get into a chat, you're getting support from the very get-go. And then once they're done with that, then they can move on. And once they feel they're set up in their travel agent business, then they can move on to my course, which is, it's called a complete getting started, or a complete guide to accessible travel, which is just a generalized course, because now we're going to have all these spin-off courses and things like autism travel and senior travel and all this kind of stuff. And so, but out of popular demand and probably out of necessity a little bit too, I am putting the finishing touches on creating a certification pathway for people who want to be certified in accessible travel planning through my company. And then they will be able to access things like a mastermind group where we will help each other travel plan. They'll get leads from the company that, that if someone goes on and they have an accessible travel need, they can fill out a form and they will be then matched with someone who's certified and up and running and part of our mastermind and all this kind of stuff. And then there will be more and more things that they will be able to do as we move this thing forward and help make the accessible travel. See, our whole thing is we want to train travel agents so our impact is greater, because I always say if Karen would have just chosen the agent pathway instead of our team building pathway, where I can build this team and I can bring people into our organization, and then make this available in an affordable way and make Sarah's brain, her left brain, and my right brain available to the entire team for virtually very little cost. This becomes very significant to people who are needing to start a side business, right? To help pay bills or to pay down debt and all that kind of stuff. So we've created this affordable pathway that is simple and complete and streamlined and up and running. And if Karen would have just started her little business in May of 2022, just to book travel for a few people, we wouldn't have any of this, right? Or if Sarah would have just said, oh, I just want to, go on cruises for cheaper every year, and hadn't chosen that second option to mentor and coach people and build a team, then we wouldn't be anywhere. So we are also coaching people on how to do that so that we can reach our goal of helping 1 million people travel that wouldn't have otherwise, because we exist.
So I think the big takeaway there is impact, right? And a lot of what I like to do and the paths that I've chosen have all been about increasing impact, right? And like I said, if I was going to have impact in the world of PT, it wasn't necessarily going to be as a physical therapist, right? I only treat 8, 10 patients a day. Maybe I affect them and their family. But if I teach cohorts of 30 to 50 students that then go out and treat 8 to 10 patients, well, now I'm increasing my impact that I can have. Now I educate the educators on how to teach. And so it's even more impact, right? And like I said, my big beef right now with the healthcare field is just the debt to income ratio for a lot of these medical professionals that are coming out. And I hate seeing people leave the thing that they went to school for so many years because of burnout or because of the debt to income ratio issues and the student loan debt crisis. So I just want to help people see the opportunities that are out there for them and still be able to leave one foot in the boat of healthcare if they want, right? And so this is a great opportunity because realistically, you don't need another degree, right? So you don't need to take on more student loan debt. You can start it as a student. You can do it as a PTA, a PT, an OT, nursing. Like you guys said, anybody in the healthcare field can do this. And the cool part is that we have that added layer of knowledge that general travel agents wouldn't in regards to accessibility, right? And just making sure that, people with disabilities or people with special needs have the opportunity to travel. And that's something that is actually very meaningful and fulfilling to the people going on these trips and traveling, but then becomes meaningful for you as well. So it's purpose driven. And so what an opportunity to be able to go to the masterclass stuff with Dean and Tony, because when they say, oh, who's doing something different? It's like, yeah, we are, because we're looking to help other people that may never have the opportunity to travel or be afraid to even try to travel because of their disability or because of their special needs. We're making it accessible to everybody. We're trying to bring that, use our medical background and our healthcare knowledge to bring that to a group of people that would need that help, right? So it's filling a need. It's something that, is purpose driven. So I love that. If you had to kind of sum up the company, what you guys do in an elevator pitch, what would that look like?
Sarah.
Apparently looks like
Take it
Sarah.
away.
Left brain.
So we really take, and it can be anyone, I mean, but we really specialize in healthcare. That's Karen's specialty. That's accessible travel planners, is mostly people in healthcare or who they themselves have some type of need. We have lots of people like that who actually have visual impairments themselves, who have come in and said, I can help with this because I physically experience it and I can tell you what needs to change. So we aren't only working with healthcare workers, but we really are here to help you start something that you can do as a student, you can do when you're working. It doesn't matter because it's flexible. And I think, even when people are students, it's hard to juggle getting a work schedule and, trying to, go to school. So having a business that you can do on the side that lets you start utilizing the skills that you have, lets you work when you want, how much you want. There's no quotas, there's no requirements with this. You are choosing to do this. You are choosing to say, I'm going to learn some basic marketing, which we're going to teach you in my course. I'm going to be willing to put in, some consistent time and effort, and I'm going to build a business where I help people travel who wouldn't otherwise have gotten to do so without my knowledge. And think about all the resources you're probably connected to because of your field to find clients already. We literally have therapists going into places, doing presentations for the population and saying, here's what I can offer. And then they're like, can we do a group trip? Can we all go? I mean, the opportunity is endless. And that's what we want to show you, is how to build that business, how to take those skills and all those endless opportunities that are out there and have us say, here's the system to use. Here's the program to follow. You get to work directly with the person who built the course on how to do accessible travel, Dr. Karen herself. And then you also get the layer of learning about how to run a business, because who knows what you might come up with on your own.
Well, and I love the fact that, again, you're taking the education piece, right? And so think about, let's walk through a scenario here. You see a patient in your clinic who is coming off of a knee surgery, and they're looking to just get, stronger, get their knee range of motion back, their strength, their endurance, because they want to take a trip to Italy in 6 months and they need to be able to walk a bunch. And they tell you that. So you set a patient-centric goal of, I will be able to walk X amount of feet in this amount of time so that I can walk around Italy when I go on a family vacation, right? How many times can you think of where you heard a patient say, oh, I want to do, I want to get better at this so I can go, on a cruise or whatever, right? Well, I actually happen to know somebody then who specializes in setting that up. So I can guide you in that right direction, right? And so now, again, you educate patients all the time on how to do these things and what they're going to need and how to transfer and adaptations and equipment they might need. Well, now you're just applying it to a business side of things to where you can help them actually plan that out successfully and have, the opportunity of a lifetime. But I also love the fact that, again, there's a business component to it, because we need to be educated in business as well. We're not taught that in PT school or OT school or nursing. I teach the business and admin course. I've taught it, and I love it, but it's small and it's short and it's one credit, and it's like you got to know the basics of billing and Medicare and all that stuff. And I try to weave in some real life scenarios and situations that are opportunities too. And this is a great opportunity because, again, it's taking skills that we've learned already in our graduate schooling and just applying it to other avenues. But again, still using it's that transferability of skills. But we do need a little help. We do need some background as far as, business and business acumen and just learning, how to operate a business. Which, unfortunately, a lot of times I see PTs and OTs get thrown into the clinic as a clinic director or manager, and they weren't trained for that. We weren't taught that. They just figure, oh, you're pretty good at what you do. Now you run a clinic. It's like, well, okay, great. But now what? So yeah, you might learn it, through hard, the school of hard knocks and going through it on your own, but it's nice to have that kind of support, and like I said, the cool thing is it's purpose driven. So you guys have a mission, you have a vision, you want to impact a million lives and do it through travel. And so I commend you guys for what you're doing. It's just an absolute awesome opportunity. Tell us a little bit about the future. Where do you see this going? And really, how do you think that you can even elevate the impact?
Well, we're really just at the jumping off place, because it's literally just in 2024 that we have reorged, and Sarah's done her thing to help us get the basics and the fundamentals going. And then we have, my one course that has launched, and over 300 people have bought that course, by the way. So where we're going in very short order is actually in a lot of different directions, with keeping with the same theme of accessible travel and just the more generalized, wide scope of it, as we also move into the more specific niche down areas. Like, for example, probably a solid 60 to 70% of my people who have joined to become accessible travel planners have done so because they want to help kiddos with autism and special needs, and their families travel. Those are a highly travel avoidant populations that are also in their prime to do travel. They're people in their 30s and 40s with kids in their, younger, teenage life and even young adult life. And so that's probably where we're going next. We are making some client handout type of deals that they can just download, buy ebooks, handouts, all that kind of stuff. We are also looking at creating a health and wellness, specializing in health and wellness travel as an adjunct of accessible travel, just for the very reasons like you just said. Excuse me, I caught a cold since last time we spoke, but so we will. That's actually the next thing I'm going to be working on, is to create that, because like you said, and this was really kind of my idea when I saw my dad preparing for a trip to Germany that we took 2 years ago before I lived here. And he knew that he was going to have to walk around a lot. He's been to Europe, and he knew he was going to be walking up and down stairs. There's just 80 bazillion million stairs in Europe, and a lot of them are in Germany. So we practice, he would practice with his walking sticks and stuff, and getting up and down. He's had back surgeries and hip surgeries and all that kind of stuff. And so, and just even like eating better and packing for the plane and all those kind of things, like there's so many aspects of that. And then since we also look at the aspects of accessible travel that most people don't, like the neurodivergent population with autism, ADHD, PTSD, TBI, like all that kind of stuff, then we also have this huge component of what the invisible disability population needs, as far as like mentally preparing for a trip and planning every aspect. We're huge on patient education, so increasing those aspects. And then of course I always have dreams of like virtual reality type stuff, and I'm communicating with someone in Italy that can do like flyovers with drones and stuff to make videos, so we could actually maybe have the capacity to actually show the people exactly what they'll have to be navigating. Here's when it's crowded, here's when it's not, that kind of thing. So there's a lot of really really fun stuff planned for the future, and just helping people travel better, more, and to where they want to be, and have it be successful.
I love
So
that. I love
that's
that.
really the biggest focus. We're looking at probably a huge expansion this year, just like we had a couple years ago. we kind of evened out a little bit over the last few months just because we were creating this next level. So now that we got it up, we're full speed ahead.
Yeah. And I love the fact too that, obviously knowledge is power, right? And you are giving people the empowerment portion of things because this is all rooted in education and patient education and practitioner education. And, obviously this podcast is centered around education, right? So it's neat to see the synergies that can be done with just the power of our mind, right? And applying our skill sets to education because that's really when things start to get interesting, that really opens a lot of doors for people. So
Yeah.
if you could give one takeaway message regarding accessible travel, what would that be?
Oh gosh, one takeaway message. I would just say, like, if there's anyone who wonders if this is for them or not, maybe if they, to become an accessible travel planner, if they, the questions I get asked the most is, well, a question I get asked a lot is it saturated already? Because you guys have been doing this, and is it saturated? And I just laugh, and I can see Sarah's like,
The answer
the
is
same
it's
because
never saturated.
because there's no way possible. I mean, right? Like old statistics from probably like before COVID show that that people with disabilities, and this is probably the major ones like mobility and whatnot, take 32 million vacations a year from the US alone. And I would be willing to bet that it's over half the country identifies as having some sort of differing ability or special need. So even if that's just a dietary difference, we have people that are extremely allergic to peanuts, and think about traveling with an extreme allergy to peanuts in this day and age. I mean, especially overseas, it's just not the same awareness and all that kind of stuff. So there's so much that goes into it that we really do need all hands on deck. And you can get as specialized as you want to be. You can start whatever you want to. I've had two students. Had two OTD students. The first one helped me make a continuing ed course for OTs that we're now going to expand also, so that we have some continuing ed for people that business entrepreneurship may not be for them just quite yet, but they want to have that knowledge and skill set. And then we also, I just helped another student who's just finished in the last couple of days. She created something she calls a sense of Disney, where because she was a Disney cast member and she went through that whole program as an undergrad. And then she she was getting her OTD, and she wanted to combine, her love of Disney with, being able to educate families and caregivers of kiddos with autism how to navigate through and have it be a magical experience instead of a meltdown one. And so she is now, both of those students, I'm now looking at hiring in different capacities and setting them up in their own business, and then also hiring them to help us do other things. So really the sky is the limit. We have people that are specializing in Parkinson's travel and, helping people who have, I'm trying to think of it, like urinary problems, right?
Mhm.
If you have a urostomy or you have bladder control issues or something like that, that's a lot. People need help with that, when they travel. So it's like the sky's the limit. So if you think about what you love to do and combine it with travel. So if you're someone that loves to golf and you're an OT, or a PT student, and you love to travel, help people, with disabilities go take golf trips. It's like it's not it's an endless supply, and it's good money. It's good side money that can become your main gig. Sarah does it full time. I'm working on that, so it's just the sky is the limit, especially when you choose to specialize in some sort of accessible travel.
Yeah. Sarah, how about you? What's your takeaway message for accessible travel?
I would really say if you're at that point in your life, whether you're a student, you're working in the field, whatever it might be, if you're looking for more because you're not fully fulfilled, could this be an answer? If you need more money because you're not making ends meet or you're still in school, could this be an answer? If you're thinking that you're not fully aligned with the jobs that you're in and you're going, I wish there was another way where I could still help people, but still use my knowledge, could this be the answer? This is the answer for so many different people. It's not just one path. So if anything we said has sparked an interest, I think it's worth at least exploring and having a conversation for you to decide if it's something you might want to do.
Yeah, I love that alignment piece because that's so huge. And anybody who starts a business or goes out on their own, does their own thing, that zone of genius, that population you just love working with, you can specialize in that because it's meaningful to you and that drives the fulfillment. When it gets hard, and it inevitably will, you'll still keep pushing because it's bigger than yourself. It's that alignment. You've got to feel that alignment. And sometimes it's hard to find that in a job, especially on the grind of the 9 to 5 and seeing too many patients and documentation and all this stuff. I really truly believe that patient care is foundational and we need that to get, a good root in our knowledge base. But after that, like Karen said, the sky is the limit. You guys can do whatever you want from there. And, if you want to become the best possible ALS therapist in the world and only work with ALS people, then lean all in, right? Go into it and just keep learning, keep getting better, stay on the path, enjoy the journey, right? It's a process. It's not an end game. It's not an end result. So lean all in. But ladies, I can't thank you enough for taking your time and coming on here. We ask all of our guests this one final zinger of a question. If you could change one aspect of higher education, whether it be PTOT or otherwise, what aspect would you change and how would you change it?
Oh, I'll go first. Well, I would change it to make it a little bit more affordable.
Number one most given answer. Yep.
And I would also say that there should be mandatory entrepreneurship business skills, not just how to bill Medicare or whatever, but like actual business skills and opportunities within the profession that they're going into to learn how to do just what we're talking about. Because there's
Healthcare is a business, whether you like it or not. You have to know, even if you don't start your own business, you have to know how you get paid. You have to know how you get quote unquote reimbursed. You have
yeah.
to know how a healthcare system operates.
Right. Yeah. So that is something that I feel like I've been playing catch up my entire life, is the business skills. And, now I can hire people to help me, but people getting started out, if you can keep it simple and just kind of learn those skills as you're learning the other skills, then you're going to be way ahead of the game.
I love that. Sarah, how about you?
Well, I mean, of course, she stole my answer. She said price, but in reality, too, I think it's also about giving them more actual in the field life experience. Like you said, there's therapists who end up all of a sudden, and it's like, oh, yeah, you're now in charge of the clinic. You have doctor in front of your name. But I've never ran a clinic before, and I've never been in this position before. So there's a lot of, we just throw people into things because they have a degree without actually making sure they're qualified to do those things. So that needs to happen in education, because that's a broad thing. It doesn't matter what field, whether we're talking about healthcare or something else. It's kind of a blanket issue for most advanced degrees, except like surgeons who are actually doing surgery, right? Like, we do it with them. Why don't we do it with anybody else?
Yeah, more hands-on experiential learning across the board. I'm a big believer in that. My dissertation was on service-based learning because I feel like if we can incorporate a community service project and I can teach you, you're probably going to learn better than if we're in the classroom on a PowerPoint slide. So get out there, get reps under your belt, learn, interact with people. I love that. Well, again, thank you for your time. Thanks for coming on here. Where can people reach out to you guys and find more information if they're interested in the opportunities that you offer?
So we will have a special link for people that are listening from your podcast. And we're also both on Facebook as Sarah Elizabeth Molnar and Karen C. Dwire OT as where our personal profiles are. So that's probably the best way to reach us.
Awesome. We'll put all those links in the show notes. Thank you so much. Been an absolute pleasure chatting with you guys.
Thank you.
Thank you.